Welcome to Professor Veronica Swallow and Professor Alison Metcalfe, who are the co-chairs of the UK and Ireland chapter of the International Family Nurse Association. We give a warm welcome to them and wish to say thank you for stopping by on our website, and that we hope you get a lot of value from it. And now Veronica and Alison are just going to talk us through some of the benefits of having a look around the IFNA website. So, Veronica, in your own words, can you describe to us what you think the unique challenges that we're faced with in the UK and Ireland?
Yes, thanks, Susan. Well, as we know, nurses play a major role in supporting people with long-term conditions right across the life course. The patient often relies on a family member to help them in this, and this can have quite an impact on the health and the well-being of the family member who's involved in that. So it can bring big changes to the roles of family members, and this can cause a lot of stress to the wider family as well. And we know that nurses are very well positioned really to recognise this and to support families to try and help them to go forward in the best way possible.
Thanks, Veronica. And Alison, do you agree? Do you want to say a little bit about how nurses could do this?
Yeah, sure. I mean, I think one of the things that both Veronica and I have probably noticed with working with families over the years in terms of our research and our clinical backgrounds is that actually nurses can make such a huge difference to the way families are supported and the way families care for their patients. And I think one of the things that we're really keen to see is that family nursing and the idea of nursing and caring for the whole family in a much more holistic way is really promoted, and that's the whole point of the International Foundation for the Nursing Association. And I think basically what we're really trying to do is promote the idea of family nursing in the UK and Ireland, because in many other countries family nursing is a profession in its own right, but we just don't take advantage of that in the UK and Ireland at all, really.
Thanks, Alison. So, Veronica, how do you know that addressing the needs of the whole family will actually make a difference?
Yeah, well, that is a good question, Susan. And we know from research that's been done primarily in other countries such as America and Japan and Denmark, we know that involving family members as carers, delivering treatments and supporting rehabilitation, for instance, can really improve patients' clinical outcomes. But we also know, although this has been less well researched, that unfortunately this can have a negative effect on the carer's own health and well-being. So it's therefore important that when we support patients, that healthcare professionals also have the knowledge and skills and the resources to support family members who are carers. And as Alison said, this has been recognised much more early in other countries than it has in the UK and Ireland, which is why we're really passionate here about trying to promote family nursing in the UK and Ireland.
Thank you. So, Alison, we're interested to know, is this happening elsewhere in the world, and can we learn from any existing international models around family nursing?
Yeah, so I mean, certainly in the USA, Australia, many countries in Europe, family nursing is seen as an important part of the profession. And sometimes there are actual family nursing qualifications. People qualify to become family nurses. In other instances, nurses do courses to learn how to nurse and care and support families better. And we see then that there are huge benefits to both the patient and the family where that takes place. But UK and Ireland, we just don't have that. As I said earlier, we just don't have that infrastructure or support. And yet we know that as we go on with a sort of ageing population, fewer nurses available to come into the profession, it's increasingly important that nurses are able to support families to provide more care and more support, and in a way that's not detrimental to either the patient or the family members providing the care themselves.
Fantastic. So, Veronica, a lot of work to do. How do you think we are going to raise the profile of family nursing in the UK and Ireland?
Well, we've got a number of strategies planned, and we've built a group of nurses and midwives in the UK who are interested in taking this forward in the UK and Ireland, and we're actively developing a website, and this website is being launched now, And through the website, we hope to bring together content that represents a suite of evidence-based family nursing resources which will help us. And we anticipate that they'll help us to facilitate attitudes towards family nursing across the UK and Ireland in all the different disciplines across the life course. And that promote and disseminate our survey results. We recently carried out a survey of 750 nurses in the UK and Ireland, asking them about their attitudes towards family nursing. We'll be presenting the results of that survey on our website so that people can make their own decisions about what that means. And we aim to share our findings with a wide range of people across different healthcare professionals, because as nurses we work in multidisciplinary teams, so it's important that we don't just see this as a nursing initiative, but it's really about healthcare. And you know, we're continuing to share the results of our research in this area to bring the focus really onto the UK and Ireland and see how we're planning to take this initiative forward.
And I think the other important thing to say, Veronica, as well, one of the things that we're doing a lot in much of our research activity is to develop new interventions to support families. And that includes using modern technologies and techniques in terms of robotics and artificial intelligence, digital technology, to really improve the way we care for patients.
And it's very timely because we now have quite a lot of connections in those areas and are working with teams who are developing these interventions. So we can, you know, work towards doing research in that area as a collective, which we are.